My name is Aditya Sukhwal, MD, MS, FAAFP, and I practice family medicine at the Platteville Clinic at Southwest Health. I chose family medicine because when I went through all my rotations, I couldn't find anything that I didn't like. I liked psychiatry, I liked family medicine, I liked surgery, I liked internal medicine, so there really wasn't a single part of medicine that I could say this is really what I want to specialize in, so I decided I would specialize in everything. My personal philosophy of care is that I want my patients to experience the same care that I would expect from my family members or from myself, and if I cannot give that care, nothing else is acceptable. The most rewarding aspect of my practice is really taking care of patients. It's really making a difference in people's lives. It's seeing them through their tough times, doing the best that I can for them, and knowing that they're getting the most exceptional care that they possibly can get, no matter if they're in Platteville, Wisconsin, or they're in some major city. I think my areas of skill and expertise there's multiple, but I would say, I do a lot of procedures. I'm very good with procedures. I'm very meticulous when it comes to suturing, making sure that, I try to minimize scars when I'm taking things off of people. And I would say mainly procedures are probably what I really specialize in. Since graduating from Platteville at college with a bachelor's degree and a chemistry minor, I went to graduate school for 5 years at the University of Louisville School of Medicine, at which time I was involved in microbiology research and also was the research coordinator for the Department of Neurology. Decided at that time that maybe seeing patients was much more fun than being in the lab and doing research, and then applied to medical school at that point. And eventually went to the American University of the Caribbean and trained in Detroit after 2 years of medical school there. I have a few hobbies. I usually spend most of my time seeing patients and doing medical practice. I like to cook, so I cook a lot. I also like to go boating, and I believe in kind of having a whole person approach to life. So I do martial arts, and I also do shooting. What drew me to Southwest Health was really that I grew up in this town. We initially moved here because my wife wanted to be next to my parents and have our children grow up in a small town. It's where I grew up, and it's kind of when you grow up somewhere, you kind of try to go back to that because that's what you want for your children.